Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today, I'm delighted to be joined by Dr. Jennifer Meller. She is the founder and CEO of Navimize. Jennifer, thanks for joining me today.
My pleasure. Great to be here.
So tell us a little bit about your background and how you ended up at this position and what got you to this point.
Sure. So I'm a physician. I'm a primary care doctor based in New York. I have lived in New York my whole life, went to NYU Med School, did my residency there, was practicing first in a faculty practice up at Columbia, then moved to establish my own private practice in Manhattan. And it was about 15 years into my career where I started to see the whole landscape of healthcare changing. Electronic medical records arrived on the scene. I started to see technology taking a real stronghold in medicine and started to see the practice of medicine really shift in a lot of different ways. And won't bore everybody with all the personal details, but mid-career decided to go back to school. I earned my MBA at Wharton. And while I was there, I had the idea for the company, for Navimize.
Fantastic. So lots of clinicians go through these sort of experiences. Do you think that opportunity to go back and study and focus on an MBA is critical to this, or do you think that was just a supporting act?
Yeah, it's a really great question. I've seen some doctors successfully do things like this without the MBA and enter into different careers and opportunities. But, the MBA really gave me a solid position from where to launch this business. I learned so many things that I wouldn't have otherwise. And I've also watched a lot of my colleagues attempt to start companies thinking that this will be easy. I understand medicine, but without understanding the business perspective, without having the background of, being taught about how to innovate and how to test before you build and those sorts of things, understanding how to target customers. Those are things that are not in the lexicon of any physician when they walk out of training or when they've been practicing.
Great points. There's a part of me that says that maybe it should be part of the medical school curriculum. And I know there's thousands of medical students going, no, we don't want any more time spent. But it really does feel that way because, business is part of healthcare and it's not something that we learned in medical school as a sort of native thing, but you have to learn it as you go along, right? So I think great that you did that. Tell us a little bit about Navimize and what the genesis of that idea and what the company does.
Sure. I'll be happy to. So in my practice, I know this will be shocking for many who've ever been to a doctor, but I always ran behind schedule and was late to my next patient. And my patients sat in that waiting room and waited. And it wasn't because I didn't care or didn't want to be on time. There were just so many things happening in the background when you're practicing and seeing patient after patient after patient that are out of your control. Sometimes people come in and it takes a lot longer to attend to the things that they've come in for. Sometimes people come in and there's an emergency. Sometimes you get a call from radiology that there's an abnormal finding on a scan you ordered 2 weeks ago. So there's all this that's going on in the background. And I felt like I had no control over this. And yet it would make my day miserable day in and day out. It would make the patients unhappy, my staff unhappy, and make me unhappy. And but really never had a way to fix this problem. And then the problem got worse when we moved into the era of online reviews. And suddenly my patients were going online and saying, hey, she's great. I love her. 5 stars bedside manner, 1 star for wait times. And I thought, oh no, this is not good. And then urgent care came onto the scene. And my patients, instead of coming to my office when they had a fever or sore throat and calling up to be seen, they opted instead for minute clinics because they could be in and out very quickly. And so there I was in business school, not intending to start a company, really intending to do different things, and started learning about lean management principles. So when I was at Wharton, we were learning about lean management principles. And it was in the context of that framework that I started to think about waiting in a waiting room as a form of waste. And then one day I walked outside, ordered an Uber, looked at my phone and said, if I can see what's happening with this car on my phone, even though it's not physically in front of me, my patients should be able to virtually peer into my waiting room and know what's happening before they head to my office and avoid the waiting. And that's how the idea was born.
Oh, that's fantastic. I think, there's a lot of common reference to Uberizing. I think this is, this will resonate with lots of people. And, you talk about a lot of things that go on in healthcare, all of these competing priorities, the 7 minutes that's on average allocated, but of course it never turns out to be on average. And, if you're the patient in front of the physician, you want the appropriate amount of time, whether that's 5 minutes or 30. And of course that, is very challenging. So it sounds like, this is a really complicated problem to solve, not just by, you can float the information up and I'm sure that improves things, but tell us a little bit about the solution and what you started to develop.
Absolutely. So what we do today is we've developed a patient communication platform. And the uniqueness of our platform is that ability, just as you said, to be able to predict wait times and push that information out to patients in real time. So that if you have a 2 p.m. appointment, we're getting you the message at 1:15 or 1:30, and then maybe an update at 1:45, letting you know how things are running in the office so that you get it straight to your phone, you know what's happening, you know when you should be coming in so that you don't have to wait. So that's what we've been able to accomplish today. It was not easy because, as you say, things are complicated on the back end. It looks very simple on the front end to the patient, but on the back end, it's actually quite complex since different offices operate differently, different specialties operate differently, and we had to figure out how to gather the information directly from the EMR to electronic medical record to flow into our system so that we could then predict the delays. The kind of vision that we have and what we're working on building now is taking that even a step further or several steps further. And what I mean by that is we are starting to look at what drives appointment length and pulling data to understand how long a given appointment is taking, so that at the time that a patient goes online or makes that call to schedule their appointment, we can predict how long they will need to see the doctor for the reason they're coming in for, so that we can schedule that 5-minute visit for 5 minutes and that 20-minute visit for 20 minutes. And we believe that will have the impact of really driving up efficiencies in the healthcare system, improving throughput for health systems, reducing wait times from the bottom up, and also improving the experience for everyone.
Yeah, so that's really interesting. I mean, not least of all the concept of saying, hey, I'm going to communicate ahead of time. And, gosh, wouldn't it be better to be waiting somewhere else? Actually, wouldn't it be better if you didn't wait at all? It feels a lot like a sort of restaurant waiting process that says, hey, we've got your table and it's coming in 20 minutes. And we know that you're 15 minutes away. So we'll give you that amount of time. Is that the sort of foundational pieces of that? Are you getting enough data to be able to sort of attribute that and start to deliver that kind of information to patients and indeed the office staff?
So we pull both information that we take from the practice at the time of onboarding, which is specific to their workflow, and also information about their preferences, and combine that with data that we get directly from the electronic medical record, including scheduling information, as well as real-time tracking information. And all of that is crunched by our algorithms to predict delays and then automates messaging to patients to let them know how the office is running in real time.
So this isn't, a manual process for the staff to say, oh, my goodness, we're delayed, although I imagine there's some opportunity for that. This is fully automated, a bit like the sort of drive ahead capability.
Correct. It's 100% automated.
Wow, that's really cool.
Yeah, it's very cool. We designed it intentionally that way because I know how busy firsthand, I know how busy a doctor's office is, and I know how busy my staff are, and that they don't have time to stop and, they're already in the electronic medical record, entering so much data. They don't have, there's no way to add more to what they're already doing. So that the whole notion of what we designed was with the idea that we would take work off their plate as opposed to adding work to what they were doing.
Right. So tell us a little bit about the integration, because to me, it sounds like data is king in all of this, and having as much as possible to be able to process. How are you managing to achieve all of this?
Yeah, so we're working with a variety of electronic medical records and partnering with them to integrate our software into their platform. And through those integrations, we're able to pull all the data that we need to power our algorithms on the back end. The nice thing about our platform is we don't have to really write anything back to the electronic medical record. So they don't have to, there's not a lot of work from their end that needs to be done. They really need to open up their APIs to us, or in certain EMR, in certain cases with different electronic medical records, it's done through direct HL7 messaging. But this is all the technical stuff. It's through those integrations and partnerships with electronic medical records that we're able to pull that data.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Dr. Jennifer Meller. She is the founder and CEO of Navimize. We were just talking about the integration and the whole process and the complexity of a doctor's office that, has so many moving parts, all of these elements that contribute to an appointment that, for an individual seems very simple. I said I was coming at 2:30 and here I am at 2:45 and I'm still waiting. You talked a little bit about the integration, the need to get that data. I think, helpful that you don't have to push back, because that always creates some problems. We've seen some improvements in interoperability with healthcare data, and the new FHIR interface that I'm sure will start to contribute and make things easier. But how are you processing all of this? What's going on in the background that sort of provides that insight to say, hey, I think things are pushing out, and also learning by the sounds of it, because you're doing some predictive analytics?
Yeah, so that's a little bit goes into our secret sauce. But we're suffice it to say that we spent a lot of time in the early days really trying to identify what are the key data points that we need to pull. What are the static data points? What are the things about the practice that are consistent over time that our algorithms need to know in order to figure this out? And then what are the dynamic data points that we need? What do we need to know about what's happening in the office today and right now, and how quickly do we need that information? And then how do we pull that all together to make these predictions? And that is what we spent, several years working on and building to get to where we are today.
So as part of your studies, did you become a data engineer, for want of another term? Is that somewhere that you've focused in on, or are you partnering with others that are doing this?
Yeah, definitely partnering. I am definitely not a data scientist. I think that takes a lot of other training. And after medical school and business school, I would say I'm schooled out. But I have a great partner who I went to actually attended Wharton with. Her background, Kavita Mangal, her background is in tech. And so she's done large-scale technology implementations, started her career as an engineer, and together we've hired other people to help us build this out.
So again, it comes back to that sort of element of what it takes to be successful, not just with, Navimize, but with other companies. Do you think that partnership is a critical element? That obviously happened as a result of, attending and participating in the same coursework. Is that one of the key pieces of contribution to allow you to launch and come out with something successfully, do you think?
Yeah, I think you need a strong team to succeed. Nobody has there's no one person that has every talent or every bit of experience needed to succeed as a startup. And especially in digital health, I think you do need someone who understands healthcare from the inside out, not just looking in as an outsider. That's enormously valuable. Having somebody who understands technology, who understands data, who understands analytics, that's another piece that's essential. And then we've added other team members. So we've added a head of biz dev to our team. The one thing that neither myself nor Kavita had or came into this having was sales experience. We neither one of us had ever gone out there knocking on doors trying to sell anything. So we really we started off doing some of that on our own and got the early sales on our own, but quickly realized that we would need someone to really kind of take this to the next level.
Interesting. I think, a recurring theme is, the combination of skills that contributes, and also what I always call the adjacent possible, the learnings from other places that we can apply, especially in healthcare, which, sometimes feels very backward in terms of some of the approaches. So you've created this, you have a software solution, you've got some of the integration. Tell us a little bit about the experiences and talk us through the process, from the perspective of perhaps a clinician, back office staff, patient.
Sure. So on the patient side, it's really very simple. They receive a text message, and that text message will let them know how the office is running. On the physician and office side, again, the system is fully automated. So once it's implemented, they really can go about their daily business and not think about Navimize. What we do when we go into these practices, in addition to gathering the data we need to power our algorithms, is we've also built the platform out and expanded it to allow for just a whole host of customizable messaging, all of which is automated. So oftentimes, my colleagues or the staff would say, I wish when I click this button and scheduled this patient for this procedure, they would just automatically get instructions sent to them. We can do that because we can set that up to power the system to send out that message just at the right moment. Or as soon as a patient is leaving an office, everybody worries about online reviews these days. And what ends up happening is that the patients who are happy with you just go home. And the patients the one in 1,000 who have a poor experience for one reason or another will take the time to go online and leave a review. So we can push out messages at the time that a patient's leaving the appointment. So here we gave them a great experience. They didn't wait in the waiting room. They were in and out. And then they get a quick text saying, hey, can you leave a Google review? And tons and tons of people will just hit that 5 stars. So we really are able to help doctors improve their online reviews. So these are all the types of things that we're able to do for practices. Patient education is another example. Say a doctor sees a patient, they're like, I wish when they left the appointment, I could just send out this information so that they learn about healthy diet and lifestyle every time someone comes for an annual visit to their primary care doctor. Well, we can set that up for you. So all of this very robust messaging is what we've built in to really make that experience for the doctors and the staff better without them having to think about it or stop their usual workflow.
So how customizable is that by practice, by patient? Are there different triggers? There's obviously the manual element that you talked about, for the physician who says, gosh, I'd really like to do this with this patient. And, you enable that. But what about some of the automation? Is that customizable so that people can get different levels of information, different details? How does that work?
Yeah, it's all automated. So the customizability can actually be down to the practice can choose. So it can be in a large organization, they may want to have all of their orthopedists send out the same messaging, or all their pediatricians send out the same messaging. But the way the system is built is that for each schedule or each doctor, they can customize the messaging according to just however they'd like. So, and even if you have a doctor who has an office in an urban location and then an office in a suburban location, they can tweak the messaging for those different locations. And so everything is set up in advance, and then they decide what messages they want to go out and at what times. We program everything, and then it just flows once it's turned on.
Fantastic. As you think about the future, tell us a little bit about where you see this going. I mean, there's a part of me that says that we might see the end of the waiting room. Is that a possibility? There is no more a waiting room. I just walk in and I'm there at exactly the right, assuming I got there by traffic and Google got all of that right as well.
Yeah, that's what we aim for. We aim for the patient to be able to walk in the door, register at the desk, and immediately be whisked to the back for the exam to begin, and then to be, seen on the way out and to go home, and for everything else to be communicated directly to them through this kind of text messaging that's elegant and set up in advance. That's what we aim for. And I think with what we call intelligent scheduling, which is the vision I was talking about earlier, where we can actually predict how long a patient will need for their appointment with this doctor when they're coming in for this problem, I think that will really drive us towards that reality.
So part of me thinks that might even be linked to a sort of payment model. I mean, right now we have this sort of very broad brush, attitude and no real sort of understanding of the complexity that it takes to deal with some patients relative to others, even though they may have the same condition. Well-managed diabetes versus poorly managed diabetes, two entirely different things. Maybe you're sort of central to the future that stops penalizing doctors and, allows us to get paid appropriately.
Yeah, it's very interesting. We've thought about that, whether there's some potential down the line for us to segment these patients and look a little deeper, so we can predict how long this patient is going to need, but then look at the patients sort of from a broad perspective and say, okay, why do these 500 patients need 20 minutes of their doctor's time, whereas these other 500 patients only need 5 minutes? What are the differentiators? Is it an ICD code? Is it their age? Is it something else? And yes, that is something that we are looking towards exploring down the line.
Yeah, I think, there's probably not a physician around that wouldn't be excited to be just actually doing the work and having appropriate payment for actual activity and, the complexity of care versus sort of this broad brush level 3 versus level 2 kind of activity, which just, I think, frustrates a lot of people. So in the closing minute or so, do you see this going into hospitals and other places? Because it sounds like this is predominantly in practices. Is this even broader?
Yeah, I think it potentially is broader applications. So right now we're in outpatient practices, so ambulatory care, but even within health systems, there are ambulatory care clinics and settings that we are penetrating. I think there's potential to adapt this for on the inpatient side as well. Certainly, in places like radiology or infusion centers, or endoscopy units. There's lots of potential. And then there's ultimately potential within the ER, although I think the ER is a little bit of a different animal and a tough nut to crack. But I do think there's opportunity within the hospital setting. So we're starting on the outpatient side, but I believe there are at least segments of the inpatient side where we can move to next.
I'm just going to say I admire your intent around the emergency medicine department, which in terms of complexity of prediction, if you can manage that, I think that would be a fantastic goal, but significantly more challenging, but plenty of opportunity, exciting space to be in. I think, when you think about satisfaction from patients, you captured that really eloquently, 5 stars for clinical care, 1 star for wait time, which, is that really fair in terms of the context that you described? Unfortunately, as usual, we've run out of time. So it just remains for me to thank you for joining me on the show, Jennifer. Thanks for joining me.
Thank you so much for having me today. I really appreciate it. And it was a lot of fun.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.